Good morning. Good morning. I'm Dr. Dangleben here with the Daily Medical Tidbit brought to you by Patient Choice. What do I want to talk about? Yesterday I talked about fetal alcohol syndrome. I spoke about cirrhosis. I talked about alcohol and high blood pressure. Today I want to talk about something that maybe you've never heard about. It's called Wernicke-Korsakoff syndrome. And it's a series of it's really two things in one, right? And it's a very serious neurological disorder resulting from thiamine, which is vitamin B1 deficiency. All right, so it's Wernicke-Korsakoff. Wernicke is what's called an encephalopathy. It's where you become confused and clouded, but it's acute and it's reversible. But it's a neurological emergency. The Korsakoff piece is really a psychosis. It's chronic and it's irreversible and it has profound memory impairment. Okay? And all this is a result of major long-term alcohol abuse. Okay? You could read up and say, well, there's some other causes, malnutrition, etc. But the predominant cause of Wernicke-Korsakoff syndrome is chronic alcohol use, right? Because alcohol interferes with your thiamine absorption in your intestine, right? It also affects how it's stored in the liver and how it's utilized by the brain. So it's important to know these things because this chronic alcohol use has several areas where you can be affected. We talk about the fetus, we talk about you with cirrhosis, we talk about high blood pressure, but here you have it, right? A syndrome where you lose your memory, all right? And you get confused, you get disoriented. We all know somebody who has Wernicke-Korsakoff right now. We do, right? And that's important to know, right? They start having gait instability. Even when they're not fully intoxicated, they walk funny. They have poor coordination, right? This is very, very important that to note. So the triad, the three things is the confusion, the mental status changes, the disorientation. Two is the eye movement, right? They almost have like cross-eyed, and the gait, the ataxia, the walking funny that I talked about. So these three things put together is a high suspicion for Wernicke-Korsakoff. The thing about Wernicke-Korsakoff, if it's left untreated, it has a mortality rate of 20%. 20%, that's pretty high, right? The Korsakoff psychosis, that part, you become amnestic. And you could no longer form new memories. And you lose some of your past memories. So what you start doing is you start confabulating. You make stories to fill in your gaps in your memory. Then your whole personality change. You have no insight. You have no, you become apathetic. All you want is alcohol, alcohol. We all, and I will keep emphasizing this, we all know somebody with Wernicke-Korsakoff right now. There's a lot of that going on in Dominica. Okay? Thiamine is an essential part, it's a cofactor in your glucose metabolism. Okay? So, and glucose is a fuel in the brain. So if you don't have enough thiamine, or your thiamine metabolism is off, it impairs the energy production that you need for your brain to function properly. And several areas in the brain needs that glucose, right? You heard of the thalamus, the hypothalamus, the cerebellum in the back. And that leads to neuronal damage and loss. When patients come in intoxicated, right, we give them what's called a banana bag. It's an IV bag that looks yellow, so we call it the banana bag. And what's in there is thiamine, folate, and magnesium, right, to deal with the Wernicke part of this. These are important things, right? So thiamine level is important to be measured and treated. And you should not even wait for labs to return. Somebody comes in, they're intoxicated, you hang the banana bag. You give them the thiamine, you give them the folate, you give them the magnesium. All right? So that's important. And you want to give them the thiamine before you start giving them any type of glucose. Okay? Because if you give glucose and you don't give thiamine, you're worsening the deficiency. Remember that's for the clinician who's listening to this, right? So thiamine, magnesium, and folate, and then talk to the patient about alcohol cessation programs. We need these things in place, guys. We need counseling. Early treatment can reverse the Wernicke encephalopathy. But once you get to Korsakoff syndrome, it's permanent. That damage to your brain is permanent, all from alcohol consumption. And alcoholics have poor nutrition to begin with, so that thiamine deficiency just continues to get worse. The prognosis is if you catch it early and you start treating these patients vigorously, you can see improvement in weeks. But without treatment, 80% of these patients will progress to what's called the Korsakoff psychosis that I talked about, which is irreversible. And the mortality, if untreated, 20%, guys. Let's continue to educate ourselves. These are preventable and treatable diseases. Right? We sit there and we consume alcohol like there's no tomorrow, not understanding the risk to your fetus, to your liver, to your life, to your brain. What type of society will we have if everybody, or a large percentage, goes down that way, goes down that drain? Remember, thiamine, which is vitamin B1, folate, and magnesium. All right? Let's take responsibility for our health, guys. I have to run. Have a great day. Peace.